Hey guys, my name is Ryan Baldeo. Check out my new article on palliative medicine and hospice care in the PAs Do That magazine. Palliative medicine or palliative care, I would say, is all serious illness. So should that be to cure or till passing? And the goal with the medical practice there is to make sure that quality of life is optimized, pain and symptom management, patient advocacy, and communication. Hospice is a version of palliative care, I guess is how I'll phrase it. However, it's limited to a life expectancy or prognosis of 6 months or less. And I use that with quotes. But ultimately, if we let nature take its course, that the quality of life and natural dying process is as comfortable and peaceful as possible. You know, my summary is to be genuine. We want to meet them where they're at, seek to understand what's going on, what do they understand is happening, and then trying to make sure that we can sit down together and come up with a plan that's patient-centered, despite the prognosis or difficulties with clinical diagnoses. So currently most PAs aren't able to fully practice in hospice care. However, we do provide end-of-life care, be that through hospice versus, in certain hospices, versus end-of-life in the hospital. So comfort care is kind of the philosophy of hospice at baseline. We want to make sure everyone is comfortable, it is natural, and we're not prolonging the dying process, but we're also not expediting it. Yeah, I think the most common one is that palliative and hospice are the same. So while we are the same specialty, palliative, we do see people till cure. We help improve quality of life during a difficult time. So should that be to transplant or cancer remission. And so we do get to see people graduate from palliative. I think the juxtaposition with hospice, while appropriate and similar philosophies, can sometimes make it difficult to truly understand what palliative can do for a patient. I think for me, medicine is pretty busy. So we lose some of the patient-centered approach. It's easy to say, hey, you have multiple myeloma and I'm giving you this medication. And we lose sight of what's important to the patient. And I don't think that that's intentional. I think that that's just the pillar and foundation for palliative. And so for me, it's really rewarding to know I can meet someone where they're at and then help them live better despite what might be going on. I love being a PA. So in brief, I worked as a secretary and the PA was the one that all of the patients used to go to. So in undergraduate studies, I said, hey, can I shadow you? And she was so willing, and that she was able to deliver the compassion and quality of care that I sought to go into in medicine. And so it was a no-brainer from even before applying to PA school that this was the right field for me. And then I've seen that throughout PA school and then clinical practice, that I get to meet the needs of the patient and the family through being a PA and wearing a strong hat, but being a strong collaborator with the whole team. So physicians, nurse practitioners, nurses, etc.